And at the same time, the Supreme Court ordered the centre to ensure at least 700 metric tons of oxygen is supplied to the national capital and asked them for a detailed plan. The Narendra Modi government informed the Supreme Court that Delhi has received 730 metric tons of oxygen just yesterday. Solicitor General also submitted statistics as to how the government is procuring and supplying oxygen to not just the national capital but also to other states. The centre informed the court that distribution of oxygen in Delhi is a problem and not the supply. And this is a very big point that the centre made. The distribution in Delhi is a problem, not the supply of oxygen to Delhi. This is the centre's claim. Delhi government, of course, on its part, thanked the centre, but also said that the Supreme Court had directed the centre to place a comprehensive plan of oxygen supply. That has not been put in place just as yet. 730 metric tons provided now, but the road ahead is still not clear. Let's listen in to Delhi Chief Minister Arvind Kejriwal.
जैसा मैंने बताया, दिल्ली को 700 टन ऑक्सीजन की ज़रूरत है. कल पहली बार केंद्र सरकार ने 730 टन ऑक्सीजन भेजी है. हम तहे दिल से दिल्ली की जनता की तरफ से उनका मुख्यमंत्री होने के नाते मैं केंद्र सरकार का बहुत बहुत शुक्रिया अदा करता हूं. मैं दिल्ली हाई कोर्ट का बहुत बहुत शुक्रिया अदा करता हूं. मैं दिल्ली सुप्रीम कोर्ट का बहुत बहुत शुक्रिया अदा करता हूं. जब तक ये कोरोना की सेकंड वेव कम नहीं हो जाती, हमें डेली 700 टन ऑक्सीजन की ज़रूरत है. ऐसा ना हो कि कल 700 टन आई और आज फिर से 400-300 टन आ जाए, फिर से सारे अस्पतालों के अंदर हाहाकार मच जाएगा. मेरी सभी अस्पतालों से निवेदन है कि वो अपने बेड वापस जितने पहले थे उतने बढ़ा लें. मैं उम्मीद करता हूं कि अब रोज़ 700 टन ऑक्सीजन आया करेगी. तो जिसके बेड थे हॉस्पिटल्स के, वो सब बेड्स अपने उतने ही बढ़ा लें.
So Delhi Chief Minister Arvind Kejriwal, while he thanked the centre for 730 metric tons of oxygen, he said in case 700 metric tons of oxygen is provided every day to the national capital, they would be able to set up at least 9,000 to 9,500 beds oxygen hospitals every day in the national 9,000 to be able to provide oxygen to people in Delhi every day. But there are those elements who are trying to profit from this pandemic, and now I want to shift focus to this big bust that's taken place in the national capital. The Delhi police has nabbed a godown owner along with two of his associates in Delhi who were selling fire extinguishers, claiming that these were oxygen cylinders. The culprits were selling fire extinguisher cylinders painted black. Now, these were the extinguishers. They were going to paint them black and then sell them at an exorbitant rate. These people were actually putting lives of Delhi residents in danger. In these images, you can see several empty fire extinguishers that were seized by the Delhi police, along with material that looked like an attempt to convert these fire extinguishers into oxygen cylinders.
ये जो आप सामने की तरफ देख पा रहे हैं, ये अग्निशामक यंत्र यानी आग बुझाने के काम में ये जो सिलेंडर है वो इस्तेमाल किया जाता है. लेकिन अब जो कालाबाजारी करने वाले लोग हैं, जो धोखाधड़ी करने वाले लोग हैं, वो इस तरीके से, ये देखिए लाल रंग का ये होता है अग्निशामक यंत्र जो आग बुझाने के काम में इस्तेमाल होता है, उसको इस तरीके से जो काले रंग में पेंट किया जा रहा था और उसके बाद जो है उसको जरूरतमंद लोगों को बेचा जा रहा था. तकरीबन 500 ऐसे सिलेंडर हैं जो दिल्ली पुलिस ने बरामद किए हैं.
I now get you an India Today impact story. The Delhi government has taken cognizance of India Today's mega ambulance expose that revealed how few ambulance drivers were duping hapless families and charging them exorbitant prices for ferrying patients. Delhi government has assured that action will be taken against those who are trying to profit from the pandemic. India Today, in our report, had shown how some drivers were charging 1,000 rupees per kilometer to take patients to hospitals in ICU or ventilator ambulances. And these are images that you see of that sting operation that was carried out by the India Today special sting team, where ambulance drivers and operators were demanding anything between 40 to 60,000, if not more, just to ferry patients from Delhi to prestigious hospitals in the suburbs, and saying the money had to be deposited first in cash and only then the patients would be taken to hospital. So India now accounts for a quarter of all the casualties that are taking place, world's deaths owing to COVID-19. And these, of course, are statistics that are given out by the government. Many argue that the actual casualties in India are higher than what the government says. So what makes this second wave far more lethal? India Today's Sneha Murdani gets us this report.
The morgues are running full capacity. Patients dying of COVID-19. Patients dying of lack of access to health care. The statistics mind-numbing. India's record is beyond dismal when it comes to the total number of deaths we have been recording in the second wave of the pandemic. There has been a 7-fold increase in deaths reported in the last 1 month in India. India has seen more than 50,000 deaths in the last 20 days alone. India Today's Data Intelligence Unit has found that if you take the 1st of May 2020 as the beginning of the first wave of the pandemic, the deaths reported on this day was 77. Compare this with 118 on the 1st of February 2021, considered the beginning of the second wave. What is the reason behind this?
This huge surge in cases, definitely one has to admit that there is some degree of decrease in the quality of care that is being provided because of the number of patients rushing into the emergency and doctors having a tough time. And that may also be affecting morbidity and mortality.
So are these deaths preventable, given that experts say there is nothing to show that any of the new variants are causing more severity? Yes, say experts.
Not relatively higher in terms of mortality rate. The numbers in absolute counts are simply astonishing. We simply cannot imagine the number of deaths we are seeing because most people are getting infected in a short span of time and they do not have the access to healthcare facilities when they deserve the most. As a result, we are seeing many preventable deaths because we simply cannot save them as we do not have enough outlets providing oxygen or medical care.
The government continues to derive solace from the fact that India's fatality percentage is below 2%. But if you look at the absolute numbers, consistently over a period of time, India is reporting more than 3,000 deaths. This translates roughly to about 125 deaths due to COVID-19 every single hour in the country. Sometimes even more than this. What's worse is that there is gross underreporting.
Underreporting of deaths is a worldwide problem and India is no exception. Access to COVID-19 testing is limited, especially in rural areas and in lower socio-economic groups. People might not have access to lab testing. If such people develop COVID-19 and die as a result, their death might not always get classified as COVID death.
A team at the Indian Institute of Science in Bangalore used a mathematical model to predict that about 404,000 deaths will occur by the 11th of June if the current trends continue. With inputs from India Today's Data Intelligence Unit, Sneha Murdani, India Today.
And doctors argue that the best way to move forward is to vaccinate as many people as possible. But is that actually happening? Unfortunately, the pace of vaccination, the pace at which it needs to escalate, that's not happening. For example, on the 6th of April, about 34,31,874 people got vaccinated. On the 10th of April, this number went up to 36,59,000. On the 14th of April, it once again came down to 34 lakhs. On the 18th of April, it was down to 27,60,000. On the 22nd of April, once again, it came down to 26,07,000. On the 26th of April, it came down even further to 25,91,000. On the 30th of April, it came down further to 23 lakhs. And on the 4th of May, it was 18,09,545. This at a time when doctors say ramp up, it's actually being scaled down. And why is this happening? What's happening to the vaccination drive in the national capital? Delhi Chief Minister Arvind Kejriwal says that people are telling him Delhi has the best facilities to vaccinate. India Today's Aishwarya Paliwal got a shot herself and tells you about the situation in the national capital.
With COVID cases surging across the country, the sole protection that we have is vaccination. The registration process is pretty simple. One gets to choose the location and time slot of his choice. Once you're registered, reach the center, get your identity card checked and get the jab. Then wait for 30 minutes in the observation room. Easy peasy.
The process in the national capital is smooth. A lot of people are now turning up to get their shots. One thing which is very important to keep in mind is to carry all your documents and also to make sure you observe yourself once you get vaccinated. This is Aishwarya Paliwal reporting for India Today with camera person Nasir Khan.
And news just coming in, Zomato delivery boys will now supply medicines to COVID patients in Delhi's suburbs in Noida. These boys have now been cleared by the district administration. In fact, the first group of Zomato teams were flagged off earlier this evening by the district magistrate of Noida. These food delivery boys will also deliver vaccines to those in isolation, those who are COVID positive, so that people don't come out of their homes and are provided the medicines at their homes. All they need to do is reach out to the district administration, and the needful, according to the district magistrate of Noida, will be done. A quick break at this stage, but don't go anywhere. Like you see people coming together in Delhi or in other parts of the country, we'll take you to Chennai, where